Aphasia is a common language disorder that can occur after a stroke. It is caused by damage to the brain's language centers, affecting a person's communication ability. Fortunately, several types of rehabilitation and medication can be used to treat aphasia after a stroke. Speech therapy is the most common form of rehabilitation for aphasia. A speech therapist will work with the patient to improve their language skills through exercises and drills designed to help them regain their ability to communicate effectively. Sometimes, a therapist may use computer programs or speech-generating devices to help a patient communicate. In addition to speech therapy, medication may also be used to treat aphasia. Drugs such as paracetam, aminophylline, and bromocriptine have improved language function in some patients with aphasia. However, medication alone is not usually enough to completely treat aphasia and is often used with speech therapy. It's important to note that the effectiveness of aphasia treatment can vary from person to person and depends on several factors, including the severity of the stroke and the type of aphasia a person has. Therefore, individuals with aphasia need to work closely with their healthcare providers to determine the best course of treatment for their specific needs. Here are some additional details on the types of rehabilitation and medication used to treat aphasia after a stroke. 1. Speech therapy. Speech therapy is the most common form of rehabilitation for aphasia. It typically involves a speech therapist working with the patient one-on-one to improve their language skills. The treatment may focus on specific areas such as word retrieval, grammar, and comprehension and may involve exercises like picture description, word repetition, and conversation practice. 2. Computer-based therapy. Computer-based therapy is a newer form of rehabilitation for aphasia that involves using technology to help patients improve their language skills. This may include computer programs that provide exercises and feedback or speech-generating devices that allow patients to communicate more efficiently. 3. Constraint-induced language therapy. Constraint-induced language therapy is a type of speech therapy that involves restricting the use of the patient's natural language abilities to encourage the use of their affected language abilities. This may include having the patient speak only in the affected language or using other techniques to promote the use of specific language skills. 4. Medication. Medication is not always effective in treating aphasia, but in some cases, it can be helpful. Paracetam, aminophylline, and bromocriptine is some of the medications used to improve language function in patients with aphasia. However, medication alone is usually not enough to treat aphasia fully, and it is typically used in conjunction with speech therapy. Overall, the best approach to treating aphasia after a stroke will depend on the patient's needs and the severity of their condition. A team of healthcare professionals, including a speech therapist, neurologists and rehabilitation specialists can work together to develop a personalized treatment plan that considers all the factors affecting the patient's recovery. Matthew, a cancer and stroke survivor, requests that you help spread awareness of severe diseases by publishing this video. Please take a moment to subscribe to and like this video.